Well, as we told you earlier, about 100 persons have been picked up today in the Central Business District of Accra. They failed to wear their face masks. And we'll be talking to Dr. John Krugu. He's a senior public health advisor at the Royal Tropical Institute in Amsterdam, also a member of the Ghana Public Health Association. Dr. Krugu, you're welcome and thank you for your time. I just read some of your messages that have come in so far. This is from Efako from Adidome. He says, I tell you today, today is market day here, but you can count the number of people wearing the masks in the markets. So that's from Adidome. This one says, there is the selective application of the law and protocols regarding COVID-19 is unfortunate. Leadership by example. The president and his people are all victims, are breaching the constitutional executive instrument. Okay, that's a long one you say there. But you say that the politicians should allow we, the health experts, to do the sensitization by providing us enough resources, but not those who call themselves information ministers and co. Please, they should spare the innocent women who cannot have their 3 square meals a day. Degura is inside Sene. You sent that one. This one says, arresting citizens who flout COVID-19 protocols and conveying them in such an overcrowded place. Won't this despicable, won't this aggravate to, won't this surge the cases in Ghana if one of them happens to be COVID-19 positive? Scenario Hardy, you send that from Techiman. And let me take this final one from Zach Ejwa, who said they should leave them alone because the laws are not meant for poor people. They should arrest Carlos Ahinkra first if they are acting according to the law. Well, the law applies to everybody equally, I must remind you. Let me talk to Dr. Krugu, who's joining us. Like I said, he's a public health expert, also a senior public health advisor at the Royal Tropical Institute. Doc, thank you very much for your time. I'll just take your brief comment on Ghana's case count at the moment. Do you see that as something that already we've confirmed that the new variant is here, but is it something that with our climate we can easily surmount in the coming few days?
Yeah, good afternoon, and thank you for reaching out to me. I think that the most important thing is that we have a problem in our hands. I am a bit worried when we make a quick reference to the climate.
Okay.
Because if you study the progression of the transmission of the virus, take for example South Africa, they have also reached a peak transmission, and if you look at the time their transmission took place, this was during the summer in South Africa, and at that time the temperature in Pretoria was the same as the temperature in Ghana. And yet they were able to get into an escalation period. So I think that the evidence as provided by WHO has not come to any conclusion that climate is playing a major role in slowing down or stopping transmission. I think we have to be careful when we make a quick reference to climate and give the impression to the general public that because we are in the tropical part of the world, we are somehow protected against COVID-19 infection. That kind of impression is part of what has brought us to where we are today, because at the moment, the bigger problem we have is a general low-risk perception towards the COVID-19. So people think that they are not at risk. And once people think that way, that is what we saw, that people are beginning to not wear the mask, to not use the sanitizers, to not take personal measures to protect themselves and to protect their loved ones from COVID-19 infection. When you have such a general low risk perception, one of the key things that we need to do, and I am okay with the President's directive to the Ghana Police Services to enforce a mask wearing. But that needs to also go along with risk communication. People need to appreciate and to understand that we are at risk, and we need to to downplay this general concept that because we are in a tropical zone, we are somehow insulated from getting infected. And therefore, people can begin to behave in a more risky way, not wearing masks, not using sanitizers, and not being careful in terms of gathering. And that is a problem. And your colleague just forwarded a video to me. And when I watched it, that was my worry, that you can even see that that low-risk perception is also within the Ghana Police Service. To what extent do they appreciate that even in an attempt to enforce the wearing of the mask, they are also putting themselves at risk. They are also getting people clouded. They are also exposing even more people to infection. So until we can, as a population, appreciate that we are all at risk, and that needs to be appreciated at the personal level, that each of us know that we are at risk, and therefore we need to take the measures to protect ourselves and to protect the general public. I think this is the next challenge that we are facing as a nation.
Well, I was just going to ask you or take your thoughts on how, from a public health perspective, perhaps we can provide some, if you like, education or advice to the police service about, because clearly they are doing their job. Because when the president announced, for them to clamp down on people who are recalcitrant, the concern by a lot of people was that nothing is happening, and the whole of yesterday nothing happened. So today they're doing their job. But from a public health perspective, how can we provide that information, that education to the enforcing authority so that they don't do it, putting themselves and other people at risk, as you put it?
Yes, so I think one of the text messages you read, I heard someone saying that they should leave the public health education to experts. And I think that is important. Sometimes we make the assumption that it just tells people that COVID-19 is here, that is enough. For example, my suggestion to the task force, the National Task Force on COVID-19, and probably to the president, is that we need to change the faces of the people communicating about COVID-19. Because what happens in risk communication is that when people become used to certain people, to certain spaces, to certain voices, people don't take what they say serious anymore. And if you follow the news very well, then anytime the president appears to speak, and the moment he says fellow Ghanaians, when he's finished, ask what did he say? And a lot of people will tell you they hear fellow Ghanaians, but they are not able to really follow what he said because somehow people assume that they know what the president is going to say. And so they don't listen and they would not act on what they are hearing because they just think, oh yes, again the president is coming and we know he's going to talk about COVID-19. And that
well, if I could just jump in there.
A lot of people did not even hear him when he talked about a new strain that has been identified.
So Doc, let me jump in there briefly. Because I guess that's where the other public health aspects like yourself and the media comes in. Because what we've been doing since the president started these updates is to break down the things that he says and to break them down in categorized discussions that make sense and that give people the perspective and that actually allows people to also participate in the conversation. So changing the mouthpiece necessarily deal with the problem? Exactly how? Because these are also health aspects that the government uses.
Yes. What I said is that there's a need to change the faces. And that is one of the strategies. Because risk communication, you cannot just use one method or one strategy. The second thing I want to say is risk communication is a specific type of communication. People need to appreciate that they are at risk. And that is not just providing information or giving people knowledge. It is not as if people don't have the knowledge about COVID-19. People do. And people know that you can be at risk if you don't. But people need their perception of risk. It needs to be raised. In other words, they need to come to this position that I am personally the one who is at risk, and not the other person, and not the other guy, but I am the one who is at risk. And that kind of communication is a specific type of communication, which is why it is important. And I agree with you, the breaking down of what the president does. In addition to that, we really need risk perception communication experts who can, and not just in general terms that it is put on television, but we also need to break this communication down to get closer to people, that public health officials in the various regions, in the various districts, should be able to get out there and do mass public education, and also speak to people. That also includes using other strategies like drama, like role play, like giving people certain experience that it is possible that they can get contracted to the virus, and people will begin to appreciate those specific methods that public health officials need to get out there. And from the video I saw, I even want to recommend that kind of risk communication needs to start with the security agencies, because with the directive, and this is just a video I saw and I felt so bad about it, that if this kind of thing happens around the country, then we would rather have the counterproductive results from what the president gave, that the police activities can escalate the infection rate, and we will have even a bigger problem in our hands. So that risk communication should start with the security agencies, so they can appreciate even the risk they be putting themselves up in an attempt to enforce the president's directive. And I think if we take these measures, and the police need to first obey their own, the president's directive, they need to obey it first, and to help other people in an attempt to enforce the wearing of the mask. Otherwise, we are simply going to escalate the transmission rate, and we will have a bigger problem.
Hopefully we will not get there. Doc, thank you so much for your time. And as we go along, I believe that we'll be able to come back to you for your thoughts going ahead with how we manage these infections. Dr. John Kruger there, he's a public health expert.